people who are most at risk of developing cervical cancer eventually are those who start to become infected by the virus that causes cervical cancer, the HPV. And if women are carrying the infection for a longer time, so the risk increases progressively. And that's really why we need to be able to pick the infection up early, because if you pick the infection up early, you can really come in very quickly and start to look for complications of the infection, which may not be cancer yet, but would be a risk of cancer, and then after that, stop the cancer itself.
So we're collaborating with an industrial company called QuantumDx, and that company is developing point-of-care molecular diagnostic machines, and we're helping them to develop those diagnostic devices. And in particular, we're very interested in HPV. In terms of the way that the study would work, a patient would go to a colposcopy clinic at St George's Hospital, and there they would provide a sample which they would provide normally through their normal patient care, which will be tested for HPV. At the same time, we would then take a second swab, and that swab will be put into a special buffer, and that sample will be given to us as the research team. We would then test that using molecular assays to find out what types of HPV are present. And at the same time, we'll also take a sample of that and put it into the quantum device. And a period later, well less than an hour, you'll get a result of whether that patient has HPV or not, and also the type of HPV that's present.
If we go to countries in the world where cervical cancer is a major problem, HPV infection is a huge issue, and you have no laboratory system at all, there's no screening system at all. And what this device is intending to do is to bring a laboratory quality analysis right next to the patient without the patient even having to travel. And that is genuinely revolutionary.